Hello, I'm Maka Lang, your account manager, and we're going to go through an AMI report for the ViMove Plus system. Just a little background on this athlete. He is about 5 months post-op ACL. He used a patella tendon graft, and he is a collegiate rugby player. Um, Something I think it's important if their parents are around, obviously this athlete is in college, but if their parent is around, I would definitely bring their parent back to hear the results because they're going to be the person making the decisions of how many more visits. They probably want to understand the information as well. And just a little bit of support for the athletes or the patients. Um, okay, so the first thing I ask them is if it is an athlete, what do you feel like you do really well in your sport? And what do you feel like you need work on in your sport? I'll ask the athlete that, and then I'll also ask the parent that. It includes them in the conversation. I think for the athlete, when they say, I do really well at this, you're able to bring in the mechanics and the results from the test and relate it back to why they're doing really well. Same thing with the weaknesses. You're you're maybe not doing as great in your sport because of these mechanics, because of this reason of what we're seeing on the assessment. And then that's an opportunity for you to kind of sell a little bit more of your services, come into PT, or if you're creating a cash pay program, it's a great opportunity to work that in as well. Okay. So as we're looking at this movement score, so this athlete scored 378 points out of 504 points. Remember, each rep is scored. 76% starting in the green. It's actually a really good score. 100% is perfect movement, which we can appreciate is nearly impossible. The highest score I've seen so far on this is a 92%. The second highest score I've seen is an 85%. So 76% for this first time doing this assessment, that's a great score. Make note if you are doing any different levels, it will not be scored out of 504 points. So they may be able to get a little bit higher of a score if they do really well on those assessments. And as they're progressing through the levels, we may see the percentage drop a little bit. But I think the main point of the movement score is, hey, you scored a 76%. That's great. We're going to dive into the metrics a little bit more to understand where some of our misses are and where you did really well in. Every time you come in and you do this assessment, I just want to see you progress towards the grade. I want to see you progress and get better. Your limb symmetry index scoring a 90.6. Typically, clinicians and physicians like to see about 90%. So well done. You're 90% symmetrical from your right to your left to your right. Now we're going to dive into that a little bit more once we get into the LSI report and figure out, are you symmetrically great or do you symmetrically need work? Loss of balance, 100%. This athlete did not lose the balance at all during the assessment. So during the single leg exercises, if they did, it would be noted, maybe one on the left, three on the right. It'll show you which leg they lost their balance on. The AMI rating is the movement score plus all of these additional factors, so some of the unchangeables. So this athlete scored 76% on their movement score. That's where we're starting off at. Noting that rugby is a high-risk sport, that's going to go into the AMI rating. Noting that this athlete has had an injury in the last year, that will also go into the AMI rating. Being a female will also go into it, and then if they've had a concussion, we can appreciate their proprioception may be off and a little bit more risk for injury. So typically the AMI rating will be a little bit lower than the movement score. Now, this doesn't necessarily mean you're at risk for injury. It just means if you're continuing with these mechanics, you're not performing to your best ability. And I think it's also worth making note, like if they've had an injury, something that I've told athletes is you have to work harder than everyone else on the field or everyone else on the court because you've had that injury. Okay. But I think also then bringing them out of that a little bit in a more positive direction is you're doing everything that you need to be doing and you're one step ahead of everyone because you're understanding the mechanics and the movements of your body to become a better athlete. limb symmetry index, so scoring a 91% overall. Okay, so how we want you to look at this is follow the colors. Red, they need work. Amber is moderate. Green is good. So here are the exercises on the left side and their scores. So all single leg exercises plus the side plank for the left. And here are the exercises for the single leg exercises plus the side plank on the right with their score. In between each exercise, you have the symmetry of the exercise. For instance, side planks here, we're testing the glute med, obliques. So they're scoring a 30 out of 30 on their left, 30 out of 30 on their right, 100% symmetry between those exercises. Interesting, as I'm looking at this, if I have, like kind of 10 minutes to talk with my patient or figure out where do I need to progress them or how do I plan my next sessions with them, follow the colors. So something really happened to this athlete on the right side. Now, I didn't label this, but the right leg is the impacted leg post-op 5 months after ACL. So something's happening as they're getting on their right leg here. Now, also, what I'm making note of is once they're getting into impact and a little bit more dynamic and a little bit more fatigued on their unaffected leg, we're starting to lose a little bit of stability, and we'll kind of dive into the metrics to understand why, but our score is going down here. So if you look at this here, single leg hop plant on the left, 27 out of 48. On the uninvolved, 22 out of 48 on the involved. Still scoring an 82% symmetry, but that's where we're looking, okay, you're symmetrically, you need work. Same thing here with the ankle lunge. So 6 out of 9 on the left and 6 out of 9 on the right, 100% symmetry, but again, 100% symmetrically that we need work. So if I'm starting to think about this, I know that once they get into a single limb on the right side, I need to focus some of my attention on that. Once they get off the ground and start doing impact exercises on the unaffected leg on the left side, I need to focus my attention there as well. But the other piece of this is the fact that there's a mobility issue in the ankle. So I'm going to make mental note of that as I'm going through their tibial inclination metrics in the single leg. Here's your movement report. So if you're doing mass testing, if you're sending the results to a physician or, you brought that parent back and they're like, okay, what did you just say to me? There was a lot of information. This is a great form for you to just hand over to the physician, hand over to the parent, hand over for the mass testing event, and just they can refer back to where they need work. From your guys' perspective, if you have 5 to 10 minutes to talk to the patient, your next patient is coming in, follow the colors. This is designed to help you save time and focus your energy on the correct topics. Now, it's important to understand who your athlete or who your patient is. If it's someone who cannot handle challenging feedback, maybe something going on at home, maybe something, maybe a little bit of a type A patient or athlete, I would pull some green in, build up their confidence a little bit. If it's someone who can handle some challenging feedback, or maybe they need to be humbled a little bit in therapy, focus on the red and focus on the amber. Again, follow the colors for your own benefit. Where do I need to focus my attention? I'm going to focus on the red and focus on the amber for my progression in therapy. So if I'm looking at the right limb and I want to understand, why are you scoring a 22 out of 48 on the single leg hop to plant on the right side? Why are you scoring in the red? Over to the right, these are general statements. So it could be because your speed was greater than or equal to 180 degrees per second, or valgus was greater than 18 degrees, or your tibial inclination was less than 23, or your pelvic movement was greater than 10 degrees. So it could be 2 of these, it could be all 4. So that's where I'm saying dive into the metrics deeper to understand what's actually happening. Here's your overall plank score. So this is the front plank. So remember, in the plank, you want to put them in the perfect position possible. Once I set them up with their feet together, they're on their forearms, their back is nice and flat, I press start. As they're moving through the plank, they're gaining points. So if they deviate outside of 8 degrees for longer than 2 seconds, it will knock them a point. If they deviate outside of 8 degrees for less than 2 seconds and recorrect back into that starting position, it will not knock them a point. If they deviate outside of 8 degrees and never recorrect, it will continue to knock points. So it's extremely important to put them in the perfect position. Back is nice and flat, press start. If you start them in extension, you're not going to see a ton of deviation here if they continue to move into extension. So if I'm looking at this plank score, this athlete scored a 30 out of 30. They did not move greater than 8 degrees in the sagittal plane or in the transverse plane. Here is our target value. So in the blue, these are best practice recommendations. The max deviation here was 7.2 degrees or 7.29 degrees. So it's still less than the 8. So they did not deviate outside of the 8 degrees, did not knock them a point. Same thing with rotation. They were able to maintain the entire time, 60 seconds, so scoring a 30 out of 30. Why is this important for athletes? Why are we testing the core? The core is the main powerhouse to make them run faster, jump higher, right? Be better athletes. If we don't have our core, we don't have anything up the chain, below the chain. So I always say if you see a large deviation and they're going into extension, that means their back is short and tight. Your body wants to use anything short and tight. When your back is short and tight, you've now taken out your powerhouse. You've exposed your abs. So what we want to train you to do is pull the hips underneath you, shorten up the abs, open up the back. So we're using our core throughout the entire course of the game. This is a great way if you do start to see some deviation early on. Like say you see deviation in the first 10, 15 seconds and they're scoring really low. Like some of the fastest athletes that I've worked with who have had hamstring injuries or low back pain, they're scoring like a 5 out of 30. And so that's just showing me that they're compensating into their back. But if they were my athletes and I'm planning for rehab, they're not able to maintain a stable position for 15 seconds. I'm not going to have them hold a plank for 15 seconds. I'm going to start working them 6 sets of 10-second holds. So we're working on quality work as opposed to quantity of the time. So it's just another way to kind of drive home what your next session looks like for therapy. This squat looks awesome. This is 59 out of 60 for the score. You can see for lumbar flexion extension, we want this to be less than 30 degrees. So as you have the subject stand and they're calibrating their spine at the very beginning, we're typically seeing like a negative number in the lumbar lordosis number. That's because they're starting an extension. As they go to squat, we should see positive numbers here, which is what we do. Now, this athlete had a pretty lordotic curve with very overdeveloped erector spinae muscles. So what we're looking at here is we're seeing some pretty low numbers because they're starting an extension standing. As they go to squat, now you have to understand, are you maintaining a flat back here? Okay, our sensors are going to pick up flexion in a few different ways. If they squat below parallel, that is going to pick up too much flexion. You're going to want to cue that athlete to get out of that squat just a little bit. That's the way that we standardize the squat from test to test. If the person's upper body actually comes over top, that will also pick up flexion. And then I've also seen if there's a pelvic wink as well. So this athlete is maintaining less than 30 degrees of flexion, so well done on this. The lateral shift, all the positive numbers we will see shifting over to the right, all the negative numbers we will see shifting over to the left here. Okay, so we want this less than 7 degrees. If this athlete shifted over to the right more than 7 degrees, you'll see a red line shifting to the right. Okay, if you start to see some trends in the negatives and the positives, the first thing that I think about, if they're shifting all to the right, first thing I think about is, okay, what's the impacted leg? Is it the left leg? Is it sore? Does it hurt? Do they not trust it? Is there an ankle mobility issue on the left side? Or is there pinching in the hip on the left side? Okay, so just kind of some ways to kind of tease out like, why are you shifting? But this athlete did really well. Side plank is very similar to the front plank. So the most active muscle in a side plank is the glute med. We put the glute med, or we put the side plank before all the single leg exercises because we want to fatigue your glute med out as you go through the single leg exercises. We want to see what you look like towards the end of the game where your coach needs you the most, but also when you're most susceptible for injury. So an interesting thing that I look at for testing athletes is I actually will test. I've done mass testing for baseball players, pitchers. I love doing this test for pitchers. I think the side plank exposes them and also like their lower half, the single leg exercises. So one thing to note, when I did the mass testing with the baseball pitchers, I tested them preseason and then also postseason. If they were right-handed pitchers, preseason, their left side plank was extremely strong because they're utilizing their left oblique to pull them through. Okay. At the end, a trend that I saw in the postseason is the athletes that were having shoulder and elbow pain on their right side, their left plank, they were scoring extremely low compared to the right plank because they were so fatigued whipping through their shoulder and whipping through their elbow, they weren't pulling with their oblique. So you could also think of that as like volleyball, an outside hitter as well, or right side hitter. Just kind of something to think about instead of just testing your lower body injured athletes. You could test healthy individuals as well to get some interesting information. All right, we're moving to the single leg squat here. So you can see this athlete scored a 43 out of 60. So this is their involved leg. 43 out of 60 here. Off to the right, you can see that there's somewhat of a higher Q angle with a pretty decent valgus. Now, if they scored in the green, you're going to see a straight up and down picture. If they score in the red, it's going to be extremely high Q angle with a large amount of valgus. This is just here to show an image to the patient, like, oh, this is what my leg looks like. Okay, when we're looking at this, you have valgus and varus, pelvic lateral tilt, valgus and varus speed, and tibial inclination as your metrics. Below that in the blue, the target values, those are our target values. Okay, those are our best practice recommendations. If you see this and you're like, holy crap, there's a lot of information, what do I need to look at? Again, you have that 5-10 minute windows explaining this to your patient. Follow the colors. Okay, so how I look at this is, and then also below, you have every individual rep so you can really understand what's happening in the first 5, what's happening in the last 5 when they're fatigued. Do I need to add in a fatigue protocol? Okay. We're giving you guys the metrics. You guys use your clinical knowledge to take home, like, what do I need to do with this patient moving forward? How I interpret this is the first thing that I look at is the tibial inclination here. So I'm looking at single leg squat on the right. Tibial inclination is the angle from your shin to the ground. Okay, so are you allowing your knee to translate over top of your ankle? So I need this athlete, and I think of like squat depth as well. I want this athlete to be greater than or equal to 31 degrees. This athlete does not get to that. So they're not squatting low enough. So when I think about this, I already remember from the LSI page, their ankle lunge assessment. They had limited mobility in their ankle. Also, a thing to note is this is their involved leg. They had ACL surgery. They used the patella tendon graft. ACL patients, they're locked up in a straight leg brace for a little bit. So they're constantly pushing off of that foot, right? The other piece, as they're getting into their movement, they don't want to bend it. They don't trust it. It hurts. It's uncomfortable. And it could also be just a true strength issue. So looking at the tibial inclination here, I know that they don't make the depth that I want them to make it in. Okay, now I need to understand why. So if I scroll all the way down looking at the ankle lunge, I know I need the tibial inclination to be at least 31 degrees. If I look at the ankle lunge on the right, they hit it 2 times, but there is one moment where they don't hit it. Okay, so to me, this athlete probably needs to work a little bit of dorsiflexion. So maybe some joint mobs, working on the gastroc, the soleus, some stretching, some ankle circles, just getting that ankle mobile a little bit more. Okay. So now as I'm looking at this, I'm like, okay, we probably need to work ankle mobility a little bit. And then I want to see when I test you again, does this actually help? As I go through this, okay, you didn't get into the range that we needed you to get into. So these numbers to me are within 26.58 degrees. I want to know what you look like within 31 degrees. So the next thing I look at is here. Valgus, so negative is valgus, positive is varus. Okay, I'm looking at the average here. You went into valgus of 3 degrees within 26.58 degrees. I want to know what you look like within 31 degrees. Okay. So the next time you do this assessment, I wouldn't be surprised if these numbers go up, because what we're going to focus on is depth of your squat, allowing your knee to translate over top of your ankle after we've opened your ankle up a little bit. And then what we have to do is we have to stabilize through this. So then I'm going to go over to the pelvic lateral tilt, 15.65 degrees. This number up top will always be positive. It is an absolute number from all of these numbers, all of these reps here. So what you have to think about is looking through the reps, what's my trend? Negative numbers means the left hip is dropping. Positive numbers means the right hip is dropping. Okay, so if I'm looking at this, I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, all negative. So that means the left hip is dropping. So I've looked at the trend. It means negative is going to the left. The second thing I have to think about is, which leg am I on? I'm on my right leg. If I'm standing on my right leg and my left hip drops, I've exposed my right glute med. I'm going into Trendelenburg. Okay. So my average is 15. I don't want it to get more than 10. So as I'm looking at this, I'm on a single leg. As I'm going into a squat, I'm bending my knee. I know I'm an athlete. I have to get deep enough. So I'm going to cheat into my hip a little bit. So now my left hip is dropping. My right glute med is exposed. Okay. To me, this is actually still a very risky movement. Even though my valgus number isn't super high, my Q angle is high. So it's still creating a lot of glute med weakness. Okay, so this is another way that you can decipher, is this an ascending issue? Is it a descending issue? Where is the issue coming from? Okay, I would definitely say a little bit of both. We know we need some ankle mobility and then also some glute strengthening as well. Speed here is in the frontal plane. So we want the speed to be low. We want it to be less than 20 degrees per second here. Okay, so speed, how fast your knee is moving side to side. So I think of stability, I think of control here. Okay, so this athlete does a really nice job. The knee does not move a ton side to side, but again, within the 26.58 degrees. If I start working on more depth of the squat, allowing that knee to translate over top of the ankle, I wouldn't be surprised the next time if these numbers go up. But again, you have to give the athletes goals. First, we're going to work on your ankle mobility. We're going to work on depth of your squat, and then we're going to control you here. The more we strengthen your glute med up, this should stay in the green, and this should also stay in the green as well. Single leg hop on the right. So this is going to be on the landing. Okay, so the limb quality score is 43 out of 60. Again, we're showing in the amber. Okay, so I'm going to look again at the tibial inclination first. Is this athlete jumping and landing with a bent knee? I need this to be greater than 28 degrees. They're scoring a 24, so no, they're jumping and landing with kind of a stiff leg. Okay, so I'm going to kind of take these numbers and understand that these numbers are within the 24 degrees, not 28. So my next thing that I look at is valgus. So this athlete only went into 5 degrees of valgus within 24 degrees of tibial inclination. The pelvic lateral tilt is 21 degrees. Remember, this number will always be positive. So I have to think, what is my trend on the pelvic lateral tilt? It looks like the majority of the time it's positive. I'm standing on my right leg. Positive means right hip, going into my right hip. So this is a retrotrendelenberg. So as this athlete is jumping and landing, he's side bending over to the right side. So I think, like, what's going on your QL here? Okay, it could also be an ankle mobility issue because we know that he does not have that absorption through his ankle to allow his knee to translate over top. So where is it going? Into maybe your back, your hip, okay? Valgus varus speed on the landing. We want this less than 96 degrees per second. He does that within 24 degrees. So as he's jumping and landing, he's not condensing as much. So of course his knee is not going to move side to side as quickly. Something to make note of, if we have a high valgus and a high speed, that's physics, that's going to cause a lot of force. Think like hop to plant, one of the most challenging ones. So as this athlete gets more dynamic, more fatigued on this right side, we're seeing their score drop. So we're scoring in the red, 22.4 out of 48. You can see the picture indicates a higher Q angle with a large valgus here. Again, my first thought, where am I going first? Tibial inclination. I want this to be greater than 28 degrees. As this athlete is jumping and landing, he's jumping and landing with somewhat of a straight leg. Okay, so again, we need to work on jumping and landing and condensing. The valgus number here, we want this less than 10 degrees. We see this jump up. Okay, so 21 degrees. So if this were my athlete, 5 months post-op, and I'm trying to understand how am I returning you back to play, I probably wouldn't put a ton of cutting in just yet. Maybe it's just some linear running, maybe a little bit of conditioning, putting them on the sidelines to do some exercises on the side. But I would like to see these numbers get a little bit closer to our target values before I started adding in some non-contact drills. So just another way to support your reasoning for why you're making the decision that you're making the decision for the athlete to return back to participation. Pelvic lateral tilt, we're seeing 18.69. Again, I'm going to look at the trend here. Again, all positive. So staying consistent with the single leg hopping. As they're jumping and landing, he's condensing and he's side bending over to his right side. Okay, so his right hip is dropping, going into retrotrendelenberg. Valgus and varus speed, we want this less than 135 degrees per second. He does that, 126, within 22 degrees of jumping and landing in tibial inclination. So again, consistent throughout the entire thing, he needs to work on his tibial inclination. Opening up the ankle joint, strengthening through that new range of motion, teaching him to allow his knee to translate forward, and then controlling his stability of his varus valgus. Also very consistent, he is cheating in his hip. Okay, so working on keeping his hips nice and parallel as he's squatting, as he's jumping and landing. So again, a lot of glute strengthening. So we already took a look at the ankle lunge. We understand that he needs work here, okay, which is actually pretty common for some of the strongest athletes. Interesting enough, when this PT was doing some of the testing, the strength testing was through the roof. Strength testing, manual muscle tests looked great, but then when they put in functionally, you can see we saw some deficits. So it's always important to do both. Utilize this AMI assessment in conjunction with what you're currently doing. So just one thing that I want to point out here is the pelvic lateral tilt. Everything else is going to be very similar on the right and the left side. Now you can compare it bilaterally. But if we're looking at the pelvic lateral tilt, so again, this number is going to be positive. We are on the left leg here, okay? I want to look at the trend. So on the single leg squat, I am seeing a positive trend on pelvic lateral tilt. Positive means hip, right hip or hips go to the right. I'm standing on my left leg. I see a trend going positive. That's Trendelenburg. The right hip drops because I'm on my left side. I've lost my left glute med. If I go down here to the single leg hop, again, pelvic lateral tilt. This will always be a positive number. I'm on my left leg. I want to look at the trend. I'm seeing negative trends. Hips go to the left. I'm on my left leg. That's retro Trendelenburg. Okay, I'm side bending over to my left side. So when you're looking at the pelvic lateral tilt, you want to think, what is my trend? Positive or negative? Negative is hips to the left, positive is hips to the right. And then 2, which leg am I standing on? Okay, right or left, because that will distinguish if it's Trendelenburg or retro Trendelenburg. And just scrolling through this just to see some consistency. Tibial inclination is off. We're missing some of the impact, or we're missing some of the control during impact. And again, tibial inclination is off. Impact as he's getting into the hop to plant cutting on the left side as well. We're seeing some deficits here. So main take home for this athlete would be, let's work on ankle mobility. Let's open up your ankle joint a little bit more. And let's teach you maybe to allow your knee to translate forward. He may be squatting with like kind of the old school mentality of weight in your heel, butt back, chest up. It makes athletes not allow their knee to translate forward. And when are we ever on our heel in a game? Rarely. So opening the ankle up, allowing the knee to translate, and then a lot of glute strengthening. And I think it's always important to know, like, when you're giving an athlete a goal, okay, we're going to work on condensing as you're jumping and landing. We're going to work on allowing your knee to translate forward so we can improve this number. The next time you come in 4 to 6 weeks later when we test you, or if I'm utilizing this as a tool in my practice, I wouldn't be surprised if these numbers jump up, but you're an athlete, and that's where that's our next goal. Work on your depth, and then we're going to stabilize you. Okay, so I think it's always important to give them goals, and then also parents to give them a plan as well. This is checking the athlete, but it's also checking you as the clinician as well. So take all of these metrics, the subjective information, and apply it to your next session.